So I just uploaded a video with the title "The Flu Vaccine is the Best Way to Protect Yourself." Now this, you could say it's part two, but I came across this with the title "3/4 of our trust employed health workers." And remember, it's this witchcraft of words. Long when it comes to hospitals and other, aspects of supposed healthcare, have you heard the term trust? But it's been more of a thing in the last few decades. The very word subliminally just basically says, hey, trust. Hey, what could be wrong with a trust? You've got to trust us. They're a trust. They're established. So, our trust-employed health workers have not taken up the flu vaccine. Public Health Agency encourage more workers to protect themselves. Now, it's this guy, whoever he is, Stephen Nolan. I have deliberately gone out my way not to look into the background. After all, in these days, it's, are you trying to bully or, whatever, somebody online? I have no idea who the individual is. What I'm appalled at is what the individual says. Yeah. So anyway, under fair use, let me, instead of grabbing a speaker, turn the volume up slightly. And under fair use, let me play you this, stopping occasionally.
A public message from the top of the health service, from the minister and from you, you're the director of public health at the Public Health Agency, of how important it is to take a vaccine, not just to protect yourself, but to protect other people. And 3/4 of trust staff either can't be bothered or...
Think about that straight away. How is this not propaganda? This is an individual skilled in what is asked of him. Straight away, can't be bothered. Yeah? Can't be bothered. Yeah?
Choosing not to take it.
Or choosing not to take it.
Is that not a disgrace?
Well, how is that not a disgrace? Look, if the very bloody health workers are a bit timid about taking it, it's maybe because they've got fucking years of experience of seeing people taking it and not ending well. Yeah? None of it should be bloody well rocket science, yeah, but, good God. I'm not saying everybody's amazing. I'm really not. But that guy's got an obligation, hasn't he? Hasn't he? Seriously.
A public message from the top of the health service, from the minister and from you, you're the director of public health at the Public Health Agency, of how important it is to take a vaccine, not just to protect yourself, but to protect other people. And 3/4 of trust staff either can't be bothered or choosing not to take it. How is that not a disgrace?
Well, as I say, the actual...
I'm looking at this seriously overweight, fat, obviously a bloody... You know where the nearest Greggs is. I'm sorry, but come on, fuck, this? Oh.
How is that not a disgrace?
Well...
Oh my God.
As I say, the actual uptake is higher than that.
You don't.
By the way, you do notice the, people in charge who are also advocating, they're actually fairly lean. You should notice that about many of them. Yeah?
Know that.
Well, we will note, they were taking steps that it will be known in future, but I would say that at the highest level, this is being raised with Trust Chief Executives to make sure
that... It's December. It's December. We're in the middle of a flu problem. And we're taking steps to... While what? While a number of our population get infected by healthcare staff that have...
Wait a minute, remember, under the premise that even though they've taken these fucking jabs, yeah, that's not enough. The very people giving you the jabs have had to take the jabs, otherwise we're giving you jabs that, because they haven't taken them, somehow you'll get infected. The absolute bollocks on steroids of this is, seriously. We're dealing with an interconnected death cult. I've tried to drop the hints over the years, even when it comes to the police. The amount of EMFs that are covering their bodies now And they're not quite the same, are they? And they're surrounded by EMFs, yeah. And I remember saying to a friend on more than one occasion, you know, you do have to wonder how many cops these days last into pensionable age, you know, and how long do they last, you know. And the same, I would argue, has to be said about many NHS staff. Yeah, they clued up a cutlass in the NHS, and there's many of them. They're more than happy to jab others, but not for that one themselves, because they know what's in them. Yeah, yeah. But this, holy shit.
Haven't taken it?
So,
How much
Again?
do they care?
so
You know, they don't. I mean, remember, anybody who's not taking this it's just a scumbag, basically, according to him. 1 minute in, and you've got this.
Message from the
Sorry to milk a point, but fuck.
top of the health service, from the minister and from you. You're the director of public health at the Public Health Agency, of how important it is to take a vaccine, not just to protect yourself, but to protect other people. And 3/4 of trust staff either can't be bothered or choosing not to take it. How is that not a disgrace?
well, as I say, the actual
Literally demonize any member of staff that may have a fucking doubt about what they've seen as they've jabbed others over the last few years. You know, the fucking bollocks on steroids of that one. And it should tell you, as I've said to many for many fucking years, don't ever for 1 second think you're on board. Yeah? You're some maybe part of whatever the fuck network and all the rest of it. You're somewhere within the public sector or union blah 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 or whatever else in your network. You can pump a thumb or two, you know, your funny handshake, all the rest of it, but there's a much bigger game being played here. Seriously, yeah? Seriously. You remember that phrase, useful fucking idiots? That's what most of Freemasonry is, you know. Upper echelons, well, you know, not so much. Well, you know. And we are seeing the fine-tuning of a cult, interconnected death cult business model, yeah?
full uptake is higher than that.
You don't know that.
Well, we will note they were taking steps that it will be known in future, but I would say that at the highest level, this is being raised with trust chief executives to make sure
It's
that
December. It's December. We're in the middle of a flu problem. And we're taking steps to. While what? While a number of our population get infected by healthcare staff that haven't taken it?
so
How much
Again?
do they care?
So I think it's really important here